Hi, I'm Lemmy McNeilly, and I'm with the American Speech Language Hearing Association.
And I'm Pat Hinton Walker, and I'm with the Uniformed Services University.
And our question was assessing teams and collaborations in community-based activities and outpatient settings. We had a number of challenges that certainly were presented. One was, who are those individuals at the micro level? And they certainly include practitioners, they include faculty, and they include students. So the learners should be considered several different groups of individuals. The challenges around ensuring that the learners at each of those levels have the opportunity to learn how to actually work collaboratively across the continuum, and with the point of care being focused on the community, is a significant challenge.
And you'll find when you look at our full report, if I can, there we go. When you look at our full report, that there's a really nice connection between the three, the micro, meso, and macro level. We had a lot of discussion about service learning and about students and sort of allowing them to be freed up, if you will, to reconnect to the social accountability that we've discussed in these forums in the past, but sometimes we get away from as we get wrapped up. So our strategy really was to engage learners, and that's defined as students, faculty, and practitioners, as Lemmy said, in transformation of curriculum by removing the barriers for students' passion, to facilitate change and provide leadership to address the social justice, civic responsibility, and social accountability in communities, so that we feel like that the current education system really just sort of puts the barriers up. And with a lot of the presentations we've had globally and locally here, we've seen that students really have transformed their own learning experience. So we want to provide opportunities and tools for the leadership as change agents, which we heard about earlier this morning globally, to provide the tools and, again, most importantly, remove the barriers for learners' commitments to leadership and social accountability. Support the engagement. We had a lot of conversation about short-term visits in the clinical site and really not being a resident anywhere and not being connected, so that's what the third one is about. Designing systems for continued input and participation with the students in the curriculum. And I think, again, what we learned from the Ghent experience is really allowing students to help shape that curriculum and providing credit for service learning projects. And so that really fit back to our macro point because we think there's some accreditation issues that are there. And then encourage innovative projects using the emerging technologies such as those that we heard this morning. And last night, just to kind of wrap that up, I had a student in one of my classes I was teaching, and this is a quote from her that I think is so relevant to what we were talking about in meso with social accountability and getting back to where our heart is. Ignorance with passion can inspire, and informed presentations without purpose fall on dead ears. And I think we have students with passion. We just need to open the doors and find and allow the creative ways to let them make changes in our curriculum and in their learning.
Fabulous. Thank you, Lemmy and Pat. And Meg, I was joking that you could say anything, but it was also intentional. One of the things that we really wanted to make sure that we did with this forum was include the voice of users of the health system, and that was the topic of your question. So you really do get to speak to each level.